I think for a lot of us there needs to be some sort of spark that makes anyone want to study dietetics. And for me, I think it was being diagnosed with celiac disease. So for that I became really excited about health and nutrition and started talking to a lot of dietitians and health professionals about the field, and I think it was from there that I really started to be interested in the whole area of nutrition and dietetics. There's been a few really good memories that I've had at UQ, so one of them being winning the Health Fusion Team Challenge Award, which was in October last year. So that was working with a whole number of different allied health professionals on the one challenge, and that's something that I've never done before. Another great memory would be starting my clinical dietetics placement at the beginning of last year. So in your third week of the master's program, you're essentially put into your hospital placement. And it was terrifying at first, but it becomes such a natural and wonderful experience. In our third semester, we're given the chance to do a 6-month research project. And for me, this was looking at how macronutrients can impact our brown fat stores. So it was a really great experience to be completely dedicated and sort of invested in the one project for 6 months, which really gave you an opportunity to sink your teeth into one very niche and specific area of dietetics. I presented my final presentation last week and got some amazing feedback on that. In my last placement, in the last 6 months of my master's, I was placed in the brain injury rehabilitation unit. And for me, that was something completely different, and I hadn't even considered that to be an opportunity that I could have in the master's program. And this was a pilot study looking at how television noise impacted how much the patients actually ate. And we did find that there was a clinically significant difference between when we had the TV off and how much the patients now ate. So seeing how our research can translate to having an impact on patients' quality of life was something really exciting for me and something that I didn't expect to be involved in. The lecturers made a huge difference to both my undergrad and my postgrad studies, and I wouldn't be here today without the support of a few key lecturers that I had over the few years. Particularly in the Masters of Dietetics program, you no longer really see your lecturers as your lecturers because there's such a small cohort. You now see them as your mentors rather than a lecturer. After graduation, I'll actually be splitting my time, so doing a part-time research position and also working part-time in private practice, so that way I can still have my two interests there in my career moving forward.